Well, we've done a lot of makeovers on this show over the years, but an in-studio cosmetic procedure is a first. Let's go to Leanne.
Well, Michael, we're here with Dr. Peter Brownrigg, and it's a first because it's now apparently simple and safe, and Lorraine said fast. We've spent a lot of time with you on the program over the years with some radically transformative procedures, one of them being, what was it called?
The nasal reconstruction with a forehead flap. These are patients who have their nose removed,
Due to a tumor.
usually from cancer, and we have to rebuild something out of nothing.
One of my favorite stories, though, is when you enabled a little girl to smile because there was a muscle or nerve issue, and then this little girl regained her smile. But we're talking purely cosmetic. We're talking what some would say superficial. When you say to a guy like Dr. Peter Brownrigg, you need a lift, he takes you literally. But this is a kind of a lunch hour transformation. We'll show some images of before and afters of the technique. That's you in surgery, which you've been doing for almost 30 years. This was an article that I guess went across the country, people asking your opinions on what was going on in cosmetic procedures now.
Yeah, there's all sorts of things that are happening in cosmetic surgery. New things, old things. Things have changed over the years. Now things are safer. Styles of things look a little more natural. And the idea is to make you look good, not over-operate.
Let's talk about that, because you say it depends on where you travel. You really do see a difference. $17 billion a year is what people spend on cosmetic procedures. That's quite astonishing.
It's a growth industry. All those baby boomers now have their kids in their house and their BMW.
We have Lorraine, who is our volunteer in studio, but before we introduce Lorraine and show what we're going to do, what are we looking at here, Dr. Brownrigg?
Okay, this is before and after pictures of utilizing fillers to increase the volume. As we age, we tend to deflate and things sag down. If you're not that sagged down, we can just blow you back up. When you get to the point where you need a little bit more than that, then it's surgery.
Okay, and you said that you actually had a consult just before. We're talking about fillers and transformations that way.
Exactly.
But for some people, you actually will do an entire facelift. What are we looking at here? This is a very young woman.
Exactly, but she's got aging in her face. Things are